The price of alcohol sold at off-licences and supermarkets should increase to cover the cost of rehabilitation of those dependent on it. That's according to the Centre for Social Justice.
The think tank, which tries to address poverty and its causes, is concerned about cuts to existing services and wants the government to consider what it calls a treatment tax. Our social affairs correspondent Michael Buchanan has the details.
At the Queen Alexandra Hospital in Portsmouth, alcohol is one of the key reasons that people are admitted.
First of all, can I ask you, do you ever drink alcohol?
Occasionally. Very occasionally. Yeah.
Since 2010, therefore, every patient arriving here, no matter what's wrong with them, has been asked how much they drink. Simple questions help nurses identify problem drinkers, and the shock of being in hospital gives staff an opportunity to begin changing behaviour.
People are really frightened about their health and they want to make a change, so we try to use that and we explain how alcohol's had a big impact on their health.
Any headaches at all?
Yeah, I had a headache yesterday.
The project has been a success. Patients have come off alcohol and stayed out of hospital. But such schemes are rare, says today's report. Researchers are therefore urging the government to introduce what they're calling a treatment tax on alcohol and to use the money raised to fund residential rehabilitation centres.
For minimum increase, 9 pence on a bottle of wine, 2 pence on a can of lager, we think we can raise £1 billion over the next 5 years to get treatment flooding through our country again. And we need to, because the Treasury is spending billions of pounds a year picking up the mess.
A similar proposal was made by the CSJ in 2007 when Ian Duncan Smith was in charge of the think tank, and it's understood he continues to support the idea. But the Department of Health says they have no plans to put more duty on alcohol. Instead, they say they're giving councils more than £5 billion to help them fund treatment courses. Michael Buchanan, BBC News.
A new memorial